it's really important to make sure young people aren't failed by the medical system at a time when we have everything else changing in our lives.
Transitioning from pediatrics to adults, there's no transition. They drop you off a cliff. Goodbye. I don't have a specialist anymore. So there's no multiple appointments. There's one doctor. If she can't handle it, it doesn't get done.
You're not just transitioning in healthcare, you're transitioning out of education. You're transitioning hopefully into competitive employment. You're hopefully transitioning into your own home. You're hopefully transitioning into even SSI changes.
Be patient with the families and understand the families. By the time you see an 18, 20-year-old, it has been a long battle. It has been a lot of providers. It has been a lot of crisis, running to the emergency. It has been a long journey for the parents. And believe it or not, if you're a good provider, we will see you as a safe harbor.
In this video, we hear from individuals with intellectual disabilities, their families, and providers about the challenges young adults face moving from pediatric to adult care settings. This transition is difficult for many young people, but is especially harrowing for neurodiverse individuals who have received their care through specialized pediatric clinics. Children's Hospital of Philadelphia notes that young people with intellectual disabilities or other special health care needs often face potentially life-threatening barriers to getting the care they need as a result of lapses in insurance coverage, not seeing appropriate providers, and losing access to medications and medical equipment. For families of color, this transition is made more difficult by the pervasive racism of our society. People of color may have access to fewer resources and are often dismissed, making it harder to advocate for their children. If they are immigrants, they may face language barriers. Additionally, racist institutions persistently fail to properly assess and diagnose young people of color, and thereby deprive them of the supports they need to thrive. As a provider for adult patients, you have an important role to play in helping these individuals find the team they need to get the care and support that will help them lead healthy and meaningful lives. In the next 20 minutes, you'll learn more about your patient's experience as they move from pediatric to adult care, how this experience may be different for individuals and families of color, and how your practice can improve health care and health outcomes for all individuals with intellectual and developmental disabilities.
The transition from pediatric to adult health care is a cliff. And we already face, when we have kids with disabilities, we already face a number of cliffs. The cliff moving from public school, where the bus doesn't come anymore and there's no more services that are guaranteed. You're not guaranteed anything once you graduate high school. You're not guaranteed a job, a place to live, income, friends. You're not guaranteed any of that. So that's a cliff. You know, there's a cliff that happens with Medicaid or Medicare, what you can or cannot qualify for as you age out of the pediatric world. And a lot of families have no clue that cliff is approaching. Nobody has told them that the pediatric hospital only treats children to the age of 18. Or nobody has told them that the pediatrician can no longer see their child after the age of 18 or after the age of 21. So just knowing that transition is yet another cliff approaching for this young person, and preparing the young person and the family for the cliff is vitally important.
But for people of color and otherwise marginalized people with IDD, it's even more difficult. I mean, We know in the first place, one of the first things that, a lot of people have to consider is getting a correct diagnosis in the first place. Again, if you are a person who lives in an underserved area, in a rural area, something of that nature, you can't get there, maybe because of transportation issues, maybe cost is a factor. We know that certainly people with IDD in general are more likely to have financial hardship, to live below the poverty line or close to it. And that's even more true for people of color who have various intellectual and developmental disabilities. But then, if you cannot access a person who can give you a correct diagnosis in the first place, how are you going to be able to get care that's tailored to meet your needs? How are you going to continue to get the ongoing care that you need as new situations arise? You don't stop being autistic when you turn 18. Your cerebral palsy does not go away when you're 22. That's not a thing that happens. And we have so much focus on intellectual and developmental disabilities and trying to train our pediatric providers about that, but not nearly as much as we need to for our adult providers. One of the things, I personally am trying to do is try to make it a little bit less scary and a little bit more applicable to our adult colleagues, to let them know that people with IDD are out there. You're going to meet them. They're going to be here in your clinic. Let's find out how we can provide the best care that we can. And then again, also take a look at those multiple intersecting identities and figure out how we can provide care to them.
Transition was very difficult because all those relationships that were built during 18 years, really 18 years, get lost. And to find a provider that will treat her with the respect she deserves as a young adult was very hard.
There are many challenges when it comes to transitioning from pediatric to adult healthcare, and often they are unique for an individual or different depending on what your disability is. But some of the biggest challenges really are the act of moving from partnership with providers who really know you over the course often of years and years and have seen how you developed and watched you grow and gathered over time this idea of you as a person, to starting fresh and new completely with providers who typically are used to serving adults and may not have knowledge or training about your condition that started in childhood.
First, as far as insurance, until 18, I was covered by my mother's insurance, basically. So everybody was already familiar with me and everything was included as well. So I didn't have to worry about figuring out who to go to.
In pediatrics, especially where I work, we are a one-stop shop. So we get to look at the whole picture. And there really isn't a place for adults to go to where it's a one-stop shop.
I was a patient at two of the best pediatric specialties clinics for their particular specialties in the state, if not the entire country. And they both utterly failed me in the transition to adult care. Kids grow up. Young children become young adults. And many of us still need specialty care. But the system is not set up to transfer us capably.
When individuals transition, especially after 21, they lose a lot of services. Insurance companies don't want to pay for the PT or the speech or the OT that has helped them get to where they are today. And that's frustrating for individuals. It's frustrating for families.
I have cerebral palsy, and all through my childhood, it was OT, PT in every way, shape, or form. Then all of a sudden you hit 18, 21, whenever you're done with school, and all that's done. Well, my condition didn't go away.
I just stopped seeing a specialist once I became an adult because the pediatric to adult specialties transition is horrible. And some specialties didn't even give me a referral to adult care. It was just sort of, well, you can't come back here, which makes it that much harder and that much less likely that I'd get the care I needed at all.
And at 18, I'm like, all right, well, what do I got to do to keep insurance? Because my wheelchair costs $30,000 and I just don't have it. So what are the things that I need to do to ensure that I could stay insured, but also that I still have access to healthcare? And some of that, again, it's a very contentious relationship.
Finding the right adult provider that understands their child's needs or understands the individual's needs. And that's also pretty difficult. There are many adult providers. I think not everybody is as comfortable with developmental disabilities as one would hope. I think there's a lot of prejudices and stigmas surrounding treating people with IDD. You know, for the adolescents or young adults who are able to fully participate in transition and, you know, be a participant in their care, I think often they're overlooked. And, you know, providers will direct questions to a family member and not the individual because they automatically think that they have a disability, therefore they can't answer the question.
As I became an adult and as I even enter my 30s, where I am right now, not only I have to figure out the best insurance plan that could cover my needs, but also researching who would accept, not accept, but understand autistic individuals like myself becomes more of a challenge.
It's really intense because it's hard. I didn't have a primary care physician from 18 to 26. And the only reason why I have a primary care physician right now is because I happened to serve on an advisory committee that was opening a new clinic. And I feel like I cheated my way into the system. And that was the only way that I was able to navigate and find a primary care physician, because prior to that, I was emergency room surfing. I was just going from one emergency room to the next. And this was worst case scenario. I wasn't going, you know, when things were okay, like I couldn't, it was the worst. And so one of the things that happened to me, I caught pneumonia and it was pretty bad.
As we've learned from individuals with disabilities, their family members, and their medical providers, there are many challenges when an individual must transition from pediatric care to adult care. Primary care providers can make their practices more welcoming for young adults with intellectual and developmental disabilities by understanding the individual's life, the role of their family or other personal supports, and their life goals. Understanding the challenges individuals and families face due to discrimination based on the person's disability, race, and other marginalized identities. Asking about the need for supports and accommodations, particularly around communication. Being committed to taking a full history and developing a referral network of specialist and ancillary service providers.
Transitioning into an adult practice or adult care, it requires to ask questions. Even if that individual is more independent, it's still asking their family members questions so they can understand what their needs are and also what the family's expectation, how much support they're going to offer. The more questions an adult provider asks of a child's history and what the family's goals are, they're more likely to have a successful transition with that provider.
This makes me think not only of my patients, but think of my own experiences within trying to access care and how many times I've been dismissed or ignored or, you know, just outright treated badly. There is a lot of pressure, I think, on people of color to come to the doctor and do a little bit of a performance of their symptoms. Do show that you are like a trustworthy person. Show that you are someone who is knowledgeable. Show that you are someone who, you know, deserves care in the first place. It's like you have to come all dressed up and you can't, or some people feel that you have to come a certain way, look a certain way to be able to just get decent, like, I don't know, compassion. Oftentimes that leads to these very big gaps in care, And whether that means maybe you're not able to continue care consistently with a psychiatrist, a neurologist, whatever, what other kind of care you need. That means that a person might go into crisis when they're in their young adulthood, and that may manifest as a mental health crisis. And again, that's not seen as, oh, this is a person who is in need of help. That is seen as, this is a person who is violent, who's destructive, who is a threat. And so maybe the police are called on them. They have a violent or even not so violent interaction with law enforcement. We have to look at, how many young adults with IDD are currently incarcerated or are some kind of related to the criminal justice system, and how that population is even further stigmatized. We definitely need to be providing better care to people with IDD, kind of regardless of their individual background, but we need to know that multiple intersecting marginalized identities are going to affect the quality of the care that people provide and that people receive.
I try to let people know to ask those core questions of what should I know about hearing and vision, and what should I know about the best way to communicate in order to get answers to my questions. Those really do set the stage.
When you fill out an application form for a new provider, there's no question on, are there any accommodations that you need? And I think for an IDD population, that's a really big question to ask, because there's so much that could be answered in that one simple question to allow providers to know who the patient is that they're going to be working with and who that individual is and what their individual needs.
One of the challenges, but also opportunities for healthcare providers and working with people with intellectual and developmental disability is to make sure that you are committed to getting the full history. And it may require being a little more creative or thinking outside of the box a bit on gathering certain aspects of the medical history in a way that's different than you have been trained. That may mean that there are things that the patient themselves is able to tell us or show us, or it might be that committed partners like a family caregiver or a direct support professional are helping me basically look at what's going on for someone head to toe by system to pick up on small changes or clues. And it is not dependent for me on somebody's ability to, in their own words, describe what they're feeling. I'm looking for all the different ways someone may show you.
What would be helpful for adult providers is for them to have resources where they can refer and make connections and partnerships with other places where they are able to care for individuals with intellectual and developmental disabilities. And it requires, I think, not just a physician to be able to do that. It requires a team to do that. And, I think one of the things that is missing in adult care also is that team of social workers and behavioral health specialists and, nurse practitioner and things like that, that can help facilitate all these things and learn different resources.
There are many bright spots around the country where creative clinical teams working, importantly, in partnership with patients and their caregivers have produced promising models of care that are really holistic in the way they approach what somebody needs, sophisticated in how they coordinate care and services with partners, and really with an eye toward what matters to the patient and the family. So I would point to examples like Neurobehavioral Home in Utah, or the Down Syndrome Clinic at Massachusetts General Hospital, or the Lee Specialty Clinic in Kentucky. Now, what's important to note is that those particular clinics and really the places with many of the most sophisticated models tend to be clinics that specialize in the care of people with IDD. It is harder to find examples of clinical groups that serve a general population, but that have also figured out how to serve the IDD population well. They do exist. The Achievable Foundation in California is one such example.
When individuals with intellectual and developmental disabilities move from pediatric to adult care, they have often spent years developing relationships with a team of specialists. In your practice, you can support their transition to adult care by asking questions and making sure you understand the individual's aspirations and challenges, actively countering institutional racism and biases, and providing culturally competent care, asking about the accommodations the individual needs to make their medical visits successful, taking a full history and using creative approaches to ensure you have all the information, building a team of providers to meet a wide variety of medical and social needs. To serve this population will require integrating a full range of healthcare services and community supports. This type of care coordination is essential for people with intellectual and developmental disabilities. But developing this capacity will make your practice better for everyone.
It is clear that any model of care coordination for this population rapidly becomes that conception of the ideal care coordination model for any patient in a complex situation. Think about it. If you can figure out for a group that really needs, at times, intensive home support, intensive school support, intensive work support, creative ways to do diagnostics or fix transportation, if you can figure it out for this population, that means that you will have built the infrastructure to serve all of your patients and their social needs.